Well, we had assumed that the worst of it for Michigan hospitals was that awful stretch before the vaccines were developed and out, and yet here we are in what administrators are telling us is even worse. And for those nurses and doctors working those packed wards and care units, the vaccine does make it worse in a way because they're watching people who did not have to die in most cases. I'm very happy to have with me this morning 4 dedicated healthcare professionals. These are the nurses working in insane conditions. Susan Grant is the Chief Nursing Officer for Beaumont Health. Erin Cavanaugh is the Clinical Nurse Coordinator for Henry Ford Hospital's Emergency Department. Brittany Anderson is a nurse in the Medical Intensive Care Unit at Sparrow Hospital in Lansing, which we know has had a horrendous stretch with the virus. And Priska Onwenyu is an ICU nurse with Henry Ford in West Bloomfield. I want to start by saying I just admire everything that you all are doing and the commitment with which you all are working. But I know this has been a horrendous stretch, so I really appreciate the time. And let me start with you, Susan. Tell me a little bit about what this stretch has been like, given that you've already been through 3 other surges, as we've called them, and they somehow keep getting worse.
Yeah, that's right. Nurses through the first surge, which was really, our highest surge, but we're very close to that now. This 4th surge stepped up and have been very devoted and dedicated to caring for their patients and families, and have done that over and over again. And this time it's harder because as time has gone on and the pandemic has been so prolonged, it has really caused tremendous amount of exhaustion and frustration, quite honestly, to see that we have people who are very, very sick, fighting for their lives, who could have prevented it and by getting vaccinated. And so it's been very difficult and very frustrating.
Priska, it's interesting because this is what you all have really been trained to do and trained for, and yet for it to just keep coming at you so relentlessly without really an end in sight is asking so much of you and your colleagues, isn't it?
It's asking so much, but at the same time, this is what we've been trained to do. This is what we do. We don't have a choice but to be there for those patients.
Well, there's no choice, but yet it's got to be so mentally taxing, and you must find yourselves, you must see a fair amount of despair and depression among your coworkers, don't you?
Yes, and even frustration to some extent, because like everyone knows, the first surge, we didn't have a choice. Nobody had a choice. There was nothing to help. We were all doing the best that we could. With this 4th surge, I mean, we have a vaccine, we have a booster, and I personally feel like if everybody would just go get the vaccine, it wouldn't be this bad. I had COVID in November. I never had to go to the hospital because I was vaccinated. I had my booster. I had mild symptoms for 2 days, and it was done.
Yeah, it's so.
That's what I'm trying to tell everybody. That's why I'm trying to tell everybody, go get vaccinated.
Yeah, we're still struggling to get that message. Yeah, we're still struggling to get that message across that by being vaccinated, yes, you may still get sick, but probably not without the dire consequences. Erin Cavanaugh, I love that you handed out superhero T-shirts to all of your colleagues, which I think is exactly exactly the right message. There must be, though, a lot of difficulty in keeping up that esprit de corps right now, but I know that that's what you were aiming at doing.
Yes, I handed out superhero T-shirts to my coworkers, and they are heroes, and they continue to be heroes. They don't feel like heroes these days. Particularly, some of the patients unvaccinated can be very difficult, and they don't appreciate due to a lack of knowledge of what we're trying to teach them. It's very grueling work. It's very difficult work. It's long hours. It's exhausting, but it's so hard to see people so sick that could be prevented. But my coworkers, I'm so grateful for them to be by my side and to just walk into work every single day, and we do the best that we can do that day. Yes.
You are superheroes then in that sense. Brittany, I have read so many stories about what's been going on at your hospital at Sparrow. It has been just horrendous. I don't know how you all are keeping up. It's been one of the real crisis point hospitals, I think, across the entire state. Tell me a little bit about what your experience has been like.
Well, as we've been talking, I've just played back through my mind when this first started. I remember when we were sheltering in place and thinking, boy, I hope this thing's over by Easter. Here we are in December 2021, and it's still surging. COVID hasn't gone anywhere. It's been really intense at work. I've been working in the ICU for 15 years. And in the last 18 or so months, I haven't seen death on this scale before. And that's been really difficult to handle personally. I've had a lot of patients reach out and grab my hand right before they go on a ventilator and beg me not to let them die. That's happened more than once. These patients have been isolated from their families, and there's very limited visiting hours and opportunities for them to see their loved ones. So I've been kind of, holding the cell phone as their loved ones have been saying goodbye to patients. And I've listened to a lot of things on the phone that have been difficult. And it's hard to just go home after work and just make dinner and act like everything's okay. If you take the stories with you, and we care about our patients. So I would say it's been really challenging.
That's what I was going to ask you all about. It was your coping mechanisms and strategies. Susan, what do you do at the end of the day? Do you find it impossible to leave work at work, or have you found a way to make the break?
I do struggle to leave work at work. I think my colleagues here on this panel, are warriors, and the colleagues I work with they're warriors. And it has been such a struggle, and you can't leave the worry at work because these are all people we care about who are saving lives literally every day, and their wellness and well-being is critical and paramount.
Yeah. Priska, I know you had an experience that has kind of been extremely formative for you through this whole experience. Going back to 2020, you had a patient that you referred to as the last man standing. Can you talk about that a little bit?
So it was a patient we had for about 1 month in our unit, and this was at the end of the first surge. So just like what everybody that's here knows with COVID, one day they do well, and then the next day they decompensate. And sometimes they die from that. But this particular man was there for a month. He would do well one day. The next day was a bad day for him. And then 2 days later, he jumped back up. So we had such high hopes for him. He was, just our last COVID patient in the unit at the end of that first surge. So everybody was praying. He'd been there, and we were hoping he would do well and he would be one of our success stories that would work out of the unit.
Yeah.
And he ended up not making it. No family at the bedside, like Britt said. So many days we will all go in and hold his hands. You could see the fear in his eyes, looking at all this unfamiliar faces he didn't know. And we were the ones that, could hold his hands and talk to him. So it was a particularly difficult one.
Yeah.
That's the one that made me go home and cry and just hate COVID and everything that had to do with COVID.
I certainly get that. Aaron, I mentioned off the top of the program, you all are trained, of course, toward good outcomes, and you live every day with that kind of hope in your heart and in your hands and minds, and yet you have had to deal with so much, not failure on your part, because certainly there have been failures in the system and failures in patients to do the best things for them, but you just haven't. Have you had enough good news and good outcomes to keep you to make it from the next one day to the next?
It is one day at a time. Devin, and there's always good news. I always try to be positive. I look at my coworkers and see the strength through them. I see patients who are willing to wait longer, who are understanding, who get what's going on. There's good news because of the science that we have available. I mean, we have so much technology, the medicines that are available. I'm very grateful for that. But the community has to participate in that. One, getting the vaccine, and two, coming in when they're very, very sick. But there's always hope and there's faith. I'm very hopeful that all the health systems will continue to have the strength that we're trained to deliver.
Yeah. Brittany, those of us in my business have struggled mightily with misinformation. I get emails constantly from people who have the craziest ideas and things to say about COVID and the vaccine. I can't imagine what it's been like for you trying to fight the flow of bad information, and you must see it almost every day in patients.
I did have to stop reading things on social media for a while. There is a lot of misinformation. I did think of one hopeful story is our very first COVID patient that we admitted at Sparrow actually recovered. And every couple months, she shows up at the hospital with a homemade lunch and drops it off to the day shift and the night shift nurses. She makes a card and gives it to us. And we have really seen a lot of support from the community. And I think that increases morale when things look really bleak here. Just getting a little note or somebody says, like, I see what you're going through and I see what these patients are going through, that makes the difference.
Yeah.
I can't even explain.
Well, we all see what you're going through. I certainly do, and I'm glad that we've allowed Flashpoint viewers this morning to see that as well. Thank you all so much for the commitment that you're keeping up every day, and thanks so much for the time. Have a happy New Year. Thank you so much.